Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. And my clinic address is 7021 Village Parkway, Dublin, California 94568. And my phone number is 408 687 1899. We are discussing health education lecture series and how the life was created from life since beginning of the menstruation of a mother, and we count it from the last day of last menstruation, first day of last menstruation. We start calculating the starting of the life of a new life, and ultimately we have already discussed about the life, how it progresses when it meets the spermatozoa, when it is settled down into the mother's uterus, and then how it develops over there, how the placenta is formed, then how the chorionic villi is adjusted over there and form the placenta. What happens? What are the hormones produced by the chorionic villi? What are the hormones produced by the placenta? And all these things we have systematically discussed in these lectures. After that, we have discussed how this embryo develops in the uterus, step by step. Everything I have described you, that after being fertilized and being adjusted into the uterus, every step of its journey has been described in these lectures. Those who are new on these lectures, they can go to my YouTube channels, homeopathic natural medicines channels, and then you can find out all those lectures serially, uh, what has been discussed in these lectures, so that you can make a chain of thoughts. You can make understand since beginning that how the life was created. And in this way, we have already discussed step by step the development of embryo, development of fetus when its name was changed. Okay, after 12th week of pregnancy, its name was changed and it becomes fetus. And until the 40th week of pregnancy, it was termed as fetus until it is born. And during the embryo state, what were the developments which occurs, which take place, and it develops into a further step? What are the complications he faced in this periods? And nowadays, what the medical science is capable of doing, removing those complications. After that, in the fetus stage, how the system and the organs develops inside this embryo and it becomes fetus. How this fetus develops all the system by uniting the different organs taking origin from different places, and how this skeleton, bony skeleton, is ossified, take origin from different places, and ultimately all the bones, all the muscles, and everything has been taken place to form the structure, skeleton inside the mother's womb. And after that, we have discussed that at what stage all the organs are completed, all the systems are completed, and they are capable of continuing life even without mother, even if they are delivered early, and then they can survive, they can continue the life even after mother. And the early pregnancy or early delivery, we have assumed that if a fetus is of 37 week, or it can survive. But till that, because all the organs are completely functionable, they function up to 32 weeks. And after 32 weeks, we assume that if under any conditions we have to deliver the baby, or it has to be delivered by under certain conditions, it can survive. And even if in a normal routine the labor starts and it is in the 37th week, we termed it as early pregnancy, as early delivery. But even then, the child can survive out of mother's womb. But sometimes, some of the organs, some of the systems may not be completely established in the functioning. Under those conditions, sometimes we need to keep this newborn baby into the incubation, so that it should be provided the similar type of living conditions as it was in the mother's womb. And then, when all the organs start functioning normally, then it's taken out from the incubation periods and he start his normal life. Before discussing the complication of the fetus, I would like to remind to those who are listening the English lectures of health education lecture series that we have discussed the complications of a female, of a mother after the delivery. And I would like to repeat just name of those ones, because every complications I have discussed in detail many times. But even then, because these are the important things in this chapter, this will be the last thing we have to discuss about the mother during pregnancy and after pregnancy, the complications. In this way, in this way, we need to repeat all these things, that what may be the complications of a mother after it gives birth to a child. So we discussed in this phase retained placenta. If the placenta is not completely discharged, detached from the mother's womb and has not been departed or delivered out of mother's womb, that may cause a complication of heavy bleeding and also sometimes the infection as well. And that may cause a heavy bleeding. Bleeding itself is a complication, but bleeding sources are there are different sources from where a mother can bleed. The first of all, uh, partially or undetached placenta, or partially detached placenta, or if any portion of the placenta is still remaining detached from the main placenta and is remained attached to the mother's womb, means piece of it remains inside the mother's womb, that continue to bleed because it has direct relation with the mother's blood vessels, which were supplying the food to the fetus at that time. But now the source is open and it is bleeding continuously. It has not stopped because that portion has not been taken out or has not come in for the delivery. So in this way, we have to be curious about the placenta, retained placenta, and the bleeding portion. The bleeding portion is not only the placenta, there are other membranes which are inside the uterus and they are supposed to come out of it and they continue to bleed. They continue to bleed, and that those bleeding timings, we have already mentioned that from 3 to 5 days continuously, this membranes, if the placenta has been delivered, this membrane continue to bleed, and that time period is 3 to 5 days, mostly 4 days. But after that, the color of the bleeding change. That blood changes into color, that becomes brownish in color, not pure blood. It is mixed with residual mucus, water, and all that. And after that, this bleeding period, after 3 to 5 days, is converted into different color. And then after that, it changes into brownish color for 1 week. And then that brownish color changes into yellowish color for 1 week. In this way, we have passed about 2 weeks in the bleeding phase. And after that, it is converted into a dirty water type, turbid water type, thick, but not having blood in it, not having any other yellowish color in it, but it is turbid water like. And it is alkaline in reaction at that time. That comes out regularly, and that is completed within 6 weeks. All dry up, all dry up, and it's complete. But we have already discussed about this thing. Sometimes this hemorrhage may continue for a longer period if the source of bleeding is still open, retained placenta, or sometimes the ulceration inside the mother's womb, or also ulceration caused ulcer or the cut you have already made to facilitate the labor, that is in the labia majora, that's called episiotomy. All the lacerations in the vagina, all the lacerations in the uterine cavity that continue to bleed if they are not taken care of properly. And in this phase, we have already discussed that after the delivery, the WBC falls down. The normal quantity is 4,000, and the platelet counts is increased. It's a natural phenomena to control the bleedings, to make fibrin. Platelet counts are increased from 150 to 450 is the normal count, but they are increased so that wherever there is a or orifice from where the bleeding is coming up, that should be blocked. But if this physiological phenomena is not occurring because of some diseases, thalassemia or other type of leukemic type diseases with which there is a tendency to bleed, blood thinning medications, which if a patient, mother is already taken for the blood control, blood pressure control, and she is taking medicines for that, but that may be also a reason behind that severe bleeding and excessive bleeding and long duration bleeding after the delivery. So all these things should be taken into considerations. If in a timely fashion the color of the blood is not changing, it means something is residual inside the womb, mother's uterus, which is bleeding and which has direct relation with the blood vessels inside the uterus. So that should be taken care of immediately and cleaned up. And it should be by under supervision of surgical intervention, so there should not be any infection going from outside to inside. Otherwise, if the infection is invading inside, Sometimes that may also be the cause of bleeding, and in that way, the WBC number will be increased. Normal numbers are 4,000 to 6,000, but they are increased in a number showing inflammation or something else. So that should be taken care of immediately in the mothers. The second thing we discussed about the white leg inflammations or phlebitis. So this phlebitis, because we advise the mother after delivery for 5 days complete bed rest, and on the contrary, platelet counts are increased, which are making the blood thick, slow to move, and already passive power of the muscles is also slow down. Obviously, blood may clot, blood may become thick, or in the venous structure, especially because uh, arteries are pushed by active force of the heart. Veins are bringing back blood from the tissues with the passive power of the muscles. And we have already advised that the mother will take rest at least completely on bed rest for 5 days so that their stiffness, tiredness, and exertion she has taken during the labor may come in rest. So that is why there are second chance that the blood may become thick and is blocked into the main blood vessels of the legs especially. And when it is blocked, it's not going normally, but heart is regularly pushing blood to the tissues. Ultimately, the legs swells up, and when they swells up, extra bleeding or the serum is collected into the tissue spaces. They swelled up and they cause pain because of the underlying nerve over there. And the secondary source, as we know, from any ulceration anywhere inside the body, when blood is coming back in the venous circulations, that contain the toxins of those tissues and bringing it back towards the heart. Nature do not want that it should go to the heart so that it should not spread to the other organs. For that, the nature has set up another system that is known as lymphatic system. And that lymphatic system is a type of filtration of toxins from the blood so that the blood should not become thick, blood should not be overloaded by the other toxin or substances coming from the ulcerated sites. That becomes a separate channel. But if this filtered substance is also in excess of quantity, that also moves with the power of the muscles, or our, if the muscles are not moving, the legs and arms and everything, our body is not moving because body is in rest for 5 days. In this condition, the legs swelled up. There are two sources of phlebitis, two sources of swelling of the legs. One is the arterial, venous. The other one is lymphatic. So by two sources, this circulation, backward circulation by the veins or by the lymphatic channel, blocks the forward flow of these serums, and ultimately they swell up. They cause severe pain because of the underlying nerve. So in this way, it should be taken seriously, and all the blood thinners and all those medications should be taken out. They should be given to the patient so that there should be a liquid blood so that it can move easily. More water is assimilated into the blood quantity, blood flowing into the blood vessels. The more water should be there and it should be liquefied, more liquefied. So, in this way, medicines may be used. Ultimately, if there is a fever, if there is other complications or signs of inflammations, those also should be taken care of. Inflammation and all that. The other thing, under these conditions, we have discussed that massage, a regular massage, so that the passive effect of the muscles can tone up the flow because mother is resting, because there should not be excessive movements and there should not be excessive bleeding because of her movement. In this way, legs should be massaged. And second thing, legs should be raised up at the level of heart so that a passive effect of the gravitational forces can push the blood downward due to the gravitations. And in this way, that flow where it was blocked may start. So all these measures should be taken in case if there be any phlebitis or swelling of the leg after the pregnancy, after the delivery. Next condition we have discussed about the rectal sheath rupture, rectal hernia. Basically, hernia means a displacement of the organ from one side to the other. And it is only possible when the way out is opened. The way out of the rectal sheath is separated. Fibers are enclosed to form a sheet of the fibers with the fat. And due to distension of the abdomen and due to pain, gravitational force that dissolves that fat tears of that fat in between the fibers, and there becomes a gap. There becomes a gap. And ultimately, after the delivery, there are chances there may be rupture, but there are chances that after that, the intestine from inside the abdomen can bulge out from that area. Though they are covered on the peritoneum, they are covered by the peritoneal covering inside the abdomen, but even then, with that covering, they can bulge it out and caused herniation, intestines bulge out. So sometimes, if it's a bigger tear, you can say, or separation, you can say, of the rectus sheath, it may be complicated and need surgical interventions. But if it's a small, may be recovered by a bandage and rest, and it can rejoin the normal structure of the abdomen in this way. So we have to take the precautions that there should not be pressure increased inside the abdomen, means there should not be any complications. There should not be any straining, defecation at the time of defecation or urination. At the time of urination, there should not be any straining. At the time of stool passing, defecation, there should not be any straining to the abdomen so that the abdominal wall can join and stay. So these type of precautions are normally taken for this one. After that, we discussed about the linea albicans. These are the strips formed when the fat under the skin is separated. It gives a different color to the skin. These are the strips. Mostly, wherever they mass, muscle fibers are distended more with the pressure and with the pregnancy, and they are separated. They are not like herniated, but they are separated. But it gives a separate color to the skin. And then with this one, basically we are unable to take care of these strips. These sometimes remains throughout the life with the female. And mostly in the thighs and abdomen are the sites where these occurs, because increase of the weight during pregnancy is a normal phenomena, about 28 pounds, out of which 7 to 8 pounds is the fetus and the membranes, and the remaining portion, remaining weight is deposited inside into the body in the muscles. And that has to come back. That's known as involution. So if the involution is taking place after the delivery, sometimes these linea albicans show more. And after that, uh, sometimes it is very difficult to cure them, because these are tiny, thin, but long, lacerated lines, long, white colored, different colored from the skin, are the lines which are known as linea albicans. After that, we have discussed about the UTI infection, because as I told you, where you put the belt in front, that's the symphysis pubis. And the back of the symphysis pubis is a bladder, urinary bladder, and back of urinary bladder is the uterus in the females. And the bladder is attached to the uterus. And when the uterus is dilated to the maximum extent, it presses the bladder with the symphysis pubis. And sometimes there may be ulcerations, ulcers, tears inside the mucous membrane of the bladder. And when there is a tear, you know that the urine is mostly acidic in reactions. And when it will pass from that one, it will cause pain. And that's known as UTI, urinary tract infection. It's difficult to pass the urine at that conditions until those ulcers, those lacerations in the urethra or in the bladder are recovered. After that, we have discussed about the mastitis, especially for those mothers who are not lactating mothers. They are not giving milk to their child knowingly or by some other reasons. Then the nature's process of prolactin hormone continues after the delivery to make milk in the breast, and oxytocin hormone to press the milk out of breast, but forcibly, under circumstances, whether she do not want to give milk to his child, or sometimes the child is stillbirth and there is no child. Under those conditions, she is bound to back up with the milk in the breast. Under those conditions, there may be an inflammation in the breast. That's known as mastitis. Sometimes there be clogging of the milk duct, means milk ducts are clogged, milk is clogged inside that one. And the natural process, I have told you many times, there is a natural process of autolysis. If ever anything in the continued flow is stopped anywhere, then by the natural process it is dissolved, and after dissolving it becomes the part of the routine back going blood, venous blood or lymphatic channels, and dissolved it. But sometimes what happens, this is not dissolved normally, and that may form a tumor, and ultimately they may lead to serious conditions like cancer, I told you. And I also told you that it's not only about the milk duct, that they are blocked with the milk, and the milk egg is sedimented over there, the solid portion is soluble over there, and then it's not dissolving and forms a cystic swelling, and ultimately the cystic swelling is converted into the tumors, and the tumor sometimes painful, and sometimes may convert into cancerous stage. Previously, many ladies died because of these conditions. They were not known to. But nowadays, the medical science has advanced, and under these conditions, under these conditions, every lady in childbearing age, especially, has been advised to go under a mammogram every year, so that anytime any change, if occurs, it should be detected and taken out and taken care of. That's why I also told to all the mothers, all the ladies, girls, sisters, mothers, that you should examine your breast twice in a month, bi-weekly or weekly. It's not that difficult. That you can, whenever you are in the restroom, you are taking a shower. Before that, you are in front of the mirror. And when you are in front of the mirror, you see your breast. Is there any change in the structure, figure of the breast? Both breasts are similar in structures, or any boundary of any breast is having diverted or different. That should be noted down. And then by the by your two palms of the hands, push your palms on the chest and press it upward to downward in your breast. And this breast should be pressed upon under your palms. And if ever there be any hard thing you feel by your palm, that should immediately be informed to your doctor, and any scan, ultrasound, or anything should be taken to detect that one, whether it's normal or abnormal. And and even if it's a normal, even then it should be taken care of, because I told you, sometimes warts, tumors, lipomas, remaining many years with your life in the body, they are not having any complaint to you, but ultimately it start paining. That's a serious condition. That's why the doctor mostly advises, if ever there be any tumor anywhere, but we are talking about the breast at this time, whenever you detect any tumor, any bump inside your breast, whether or not it is painful, even then it's more advisable and good to take it out, so that it ultimately may not cause any serious problem for you. Nowadays, previously, many ladies were dying because of these type of complication of the breast after birth, or even during menopause as well. Those tumors are converting into cancerous stage. That is why the doctor advocates that every year you should have you should have this mammogram done. And if anything you could not detect yourself by inspection of the breast, or by palpation by the palms or by your hands, if you cannot palpate that one, then it should be taken care by the ultrasound of the breast, and you can detect it, and you can take care of that properly with the advice of the doctors, so that in future it should not cause any problem to you. So the clogging of the milk duct obstructions, mastitis, all these things are the serious conditions, may convert into serious. Therefore, they should be taken special care to remove those things. And after that, the last portion of this lecture for the females, we have discussed about the Uh, depression. That depression may be because of the pain she has gone through, because of the care which she deserves has not been given to her after the delivery, and especially in our society. I know most of the things about my society. If child is a female child, even mother is not taken care of properly, and the child is also not taken care of properly. Under those conditions, there are chances that the mother who gave birth to this child may go in depression. Therefore, this chapter is also should be taken care of and tackled accordingly. And mother should be given a soothing atmosphere so that she should can adjust, especially in case of female child, and she should not be depressed, she should not go under anxiety. And there are nowadays because abandoned mothers and abandoned children sometimes go under many complications, and the mothers go under the anxiety, and psychiatric department has developed a separate type of department for these type of conditions, so that mothers be advised psychologically psychologically uplifted morally, so that they should not go under depressions. And also, the lactating mothers, it's okay, but non-lactating mothers are also advised accordingly under circumstances and initiated that they should give milk to their child, to their newborns. It will save your child as well as your health. It's good for your health as well, so that both will be benefited if a mother becomes the lactating mother. In this condition, we must take care of the mother properly, so that she should not go into depressions. Now, these are the complications. I have repeated this chapter because I want that mothers, because of mothers, this whole world is in existence. If mothers are not there, the world will not exist. That's why I'm stressing very, very forcefully on these chapters repeatedly that these are the complications, and you should take care all these properly. These should not happen. But in case if they happen in any mother after the delivery, you should have measures to take care of those conditions separately. Now, come to the child side. Now, the child is born, and you have cut the umbilical cord. Cutting of the umbilical cord is known as golden hours. He was living in the mother's womb. Everything, everything which is required by the general systems of the body. As you know, there are nine systems working inside the body, and all the nine systems were taken care by the mother at that time. But now the child has come out, and he is given all the responsibility after cutting the umbilical cord that you have to do that yourself. And in these conditions, the first thing is there should not be any infection. Antiseptic measures should be adopted, and the umbilical cord should be ligated in a proper way. And that proper way was 2 inches from the fetal abdomen, first clamp, and 1 inches from the fetal umbilicus. And in between that, you have to make the cut. Means at least 1.5 inches of the umbilical cord should remain with the fetus, and then it should be tie up strongly so that it should not ooze blood. Because now, if ever it will ooze blood, it will be coming from fetal side, and fetus is not having that big blood which he can use and he can survive. If it's oozing, it may cause serious conditions. Therefore, the first instruction is to tie the umbilical cord in a way that it do not oozes any blood. Second, antiseptic measures should be adopted by cutting and after of the ulcers you made after cutting, so that there should not be any infection attacking to the child via the umbilical cord. After that, you have to detect any injury, especially to the head or to the limbs. Sometimes uh, breached uh, breech delivery is a difficult delivery, and sometimes with the negligence there may be fracture on the legs or on the arms sometimes, or sometimes there may be fracture on the skull. So after the delivery, we have to detect that. How you detect that? Wherever there will be breakage of the bone and the torn of muscles inside, that will cause a hematoma above that one. And that hematoma is the detection that underneath there is some wrong, maybe fracture, maybe muscles are torn, all that one. And they should be taken care of properly. Also, in the scalp, in the legs, or in the arms, should be detected properly, that because these bones are already formed, though they are soft bones, but even then if there be a fracture, that should be tackled carefully. Otherwise child will continue to cry with the pain, as the nervous system will be stimulated to work, function normally, and the pain will increase. So any hematoma, tumor formed by the inside oozing blood, should be taken care of. For the underlying cause, whatever the causes are underlying, they should be taken care of. Second thing, fovea capitis, mostly on the presenting part. Mostly if the delivery is on the head, by the head, whatever part is a presenting part, whatever part is coming first out from the mother's womb, that is known as the presenting part. And on the presenting part, with each pain, first of all, the amniotic fluid is pushed forward. Then the pain goes. When the head goes back with the abolish of the pain, water comes in. Then again pain comes, head blocks that one. Then water bag is also increased in size. Ultimately, it increases in size. It increases in size with each and every pain. And we have to take care of that one properly, that there should not be any with the pressure. Sorry, I'm talking about the fovea capitis. So on the presenting part, whatever part is coming, the skin, the scalp of the head, just like talk about the skin of the head, skin of the scalp is pressed forcibly, and it forms a type of tumor, cystic tumor. Fluid inside the skin is collected with the pressure upward, and that forms a bulge out separate because the bones are making a round ball of the skull. But this type of swelling of the inside fluid of the cells, which is pressed down, and the fluid has come up with the pressures outside in the tissue spaces. That forms, that's known as fovea capitis. And that fovea capitis is not a serious thing, especially if there is no hematoma, if there is no breakage of the bones inside or anything else. Ultimately, it goes within a week or so. This fovea capitis goes off. But it should not be confused with, it should not be confused with hematoma, because hematoma is when there is a blood accumulated in the swelling, in the tumor, and that indicates that something is serious inside and the skin. Maybe fracture of the bones, maybe bleeding inside, so that should be taken seriously. But otherwise, this fovea capitis automatically goes off in a due time. So that's not a problem. That's not a problem. So first thing we discussed structural abnormalities, if there be any, on the presenting parts. And second thing, any fracture or any hematoma separate from the fovea capitis should be taken care of. After after taking care of this one, now come to the structural abnormalities. We told you previously that all the organs are formed completely up to the 20th week of pregnancy, fifth week of pregnancy, you can say. Oh, sorry, fifth month, not week. Fifth month of pregnancy, all the organs take a shape inside the body of the mother. But up to 32 weeks, all the organs are now capable of working and are working inside, though mother is supplying the everything. It collects the urination outside and it passes child's urine with his urine. It collects everything, stool, and passes it with his stool, her stool. So in this way, everything was taken care of by the mother. And now, when the child has to start everything, we should make sure that all the organs are normally formed and functioning. And that we assume after 32 weeks of pregnancy, means 7 weeks of pregnancy, 210 days of pregnancy, that all the organs are capable of surviving outside mother's womb. They can survive. But sometimes, due to some factors, genetic factors, some deficiencies, some food deficiencies, all these things, sometimes some of the structures are not formed fully in the child. And that should be taken care of properly. The first thing I can tell you, cleft lip. You might have seen many children, but not nowadays because we are taking care properly in the developed countries. But underdeveloped countries, still there are these type of complications. If the folic acid is not supplied normally, if the iodine is not supplied normally to the pregnant women, sometimes the development stops at one point, does not complete. Just like I told you, the all the organs, all the structures are ossified. They start from different points and ultimately they join to form the complete structure of an organ. Same way for the bones. One bone is ossified from many places and then they unite. Then they form a complete bone. In this way, our facial bone, this cheekbone, that is known as zygomatic bone. That zygomatic bones ossify from both sides, and develops in the middle, where there is a nose. In the roof of the floor of the nose, they unite with each other and form the hard part of the oral cavity. When you open the mouth, this whole cavity is known as oral cavity, and this oral cavity is a roof under the it's a floor of the nose, but roof of the mouth, roof of the oral cavity, buccal cavity. It has two different structures. In front, from the teeth line, baseline of these teeth of in front, upper teeth, in the back side, there is a hard plate. And after the middle portion, it's a soft plate. It's a soft plate. And if in case this bone is not completely formed at that time, under those conditions, you can well imagine the upper face bone is not uniting, not compacting, it's white. And the same way, sometimes it's a complete separated. Even the soft plate is also separated, it is not completing. And under those conditions, it may happen under those conditions, it may happen that there is a cleft plate. Not only the lips, not only the lips are separated, the bone underneath is also separated. And this roof of the oral cavity or the floor of the nose helps us to swallow the things inside, whatever is going into the mouth, just like we swallow any bolus. It helps us to compact press and press downward. And well imagine when the upper portion is not taking, you in your hands, a handful, you are taking something to close in the hands and the upper portion is open. What will happen? Whatever is in your this lab, it will come out, and the outward is nose. It will come out from the nose. If it comes out of the nose, it means it's a very difficult conditions. Nose will be blocked with milk. Child will not be able to swallow it. Child will not be able to breathe properly when he is sucking the milk. It's a serious condition. Sometimes it needs to be taken care of at the same time. But if it's only cleft lip, people survive with that one. But nowadays there is a surgery. We can we can stitch them, we can unite them, and we have means for that. And the rupture of the bone. If the bone is not uniformly united inside the under the nose, then it is a serious condition, and that must be taken care of. Cleft lip, cleft plate. Cleft plate is a serious thing that should be taken care of properly. And it comes in the food feeding problems. Child cannot swallow. Child will not take milk because milk is coming out from the nose. He swallow, but that is not going downward, it goes upward. Just like in your handcuff, you press something which is inside your cavity of both hands, it will jump up. Some of them will go downward, and ultimately it will cause a respiratory problems as well, and blockage of the nose, and also the small quantity of food will go down in the pharynx, in the food pipes, and ultimately the child will become weak. Even if you give him milk repeatedly, you give him diet formulas, whatever it is, because it is not going downward. The normal quantity of food is not going downward. Under those conditions, It causes weakness, anemic child, all that things. So this should be taken into mind for the newborn babies. Ultimately, after taking care of all these things, the next thing we must consider, even if there is no cleft lip, there is no cleft plate, everything is normal, we must take into considerations that the normal labor period was from 12 to 16 hours. Though it's for the para ladies, it's less, but mostly for the nullipara or primipara, those who are giving first time birth, this type of ladies generally has to suffer more than 16 hours sometimes. But the normal period is 12 to 16 hours. And well, imagine the child has suffered devoid of food as well during this labor period. Mean if child has not given food properly, which mother was supplying from the umbilical cord, then under this condition, starvation will occur. The signs of starvation will occur. Sign of starvation, anemia, and weakness, and ultimately it can attract infection as well. Easily infection. If someone is healthy, all infections he can combat. But if the person himself is weak, under those conditions, under those conditions, the child will become more weak. Signs of starvation: weak skin, velvety skins, just like wrinkled face. All these things will show up, and the nails white. All these things show up. Shrunken eyes as if they are pushed back because child is anemic, has not given the food since 16 hours, even more, and that should be taken care of at that time. Starvation, it also comes in the feeding problems. So feeding because of the cleft plate, and feeding problem because of the weak child due to starvations. He is unable to suck milk, whatever you are providing. It's a difficult for him to swallow because he's weak. So special measures should be taken so that a normal food can go inside mother baby's tummy to start the process of digestion and further, because now he has to develop himself, take care himself for all the enzymes, for all the bloods and everything away from the mother. So in this way, the feeding problem and starvation, which also can result in low blood sugar, because he has not taken food. Even if you yourself has not taken food properly, you will show signs of low sugar in a normal way. Even a diabetic person, if he is not taken food normally, undergo hunger strike or starvation, the diabetic, you can say it will go down. In this way, the child has gone and low sugar because he was not provided food for many hours. And we will discuss, because today's time is over, and we will discuss further complications of the children's day after tomorrow, because tomorrow will be Punjabi and Hindi program, and next day will be the English program, and discuss the other complications management to the newborn child. I am your host, Gurdeep Singh Sandhu, homeopathic consultant. Anytime when you are tired of all treatments for any disease, you can call me at any age. You can call me at 408 687 18 Or you can email me for your concerns. Homeomedicine, HOMEOMEDICINE at yahoo.com. You can call me by email and you can get your answer of your sickness, and also by phone too. If ever you want to take homeopathic medicine, yes, you can call me. If ever you want to get treated by homeopathic system, or you want to take second opinion of your disease, you can call me at 408 687 1899. God bless you all. We'll see you tomorrow again on the Health Education Lecture Series at 5 p.m. California times. Every day, as you listen these lectures at 5 p.m. California timings. Rab Rakha.